Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and very good morning to everybody. It's nearly noon, so I really hope everybody is fresh and excited for the topic. It has been a heavy topic since this morning, but mine gonna be a little bit lighter and a little bit like more to discussion. So I really hope it's gonna be bring a new concept and is going to be interesting for everybody of us, everyone for us. Okay, so it is an honor for me actually to be speak among all the very great panels for today. So I'm one of the youngest, but I believe I'm one of the most passionate person today. So wearing pink is one of the theme for today is right for help for women. So we are excited for this topic. So as the my friends, the MC actually um introduce me. I'm Dr. Nurul Fazilah Aziz. I am a medical officer as well as a program coordinator for Unit HIV, STI, Hep C, and Methadone in PKD Seremban. So here's a little bit of my details. Okay, so um, I think it is not too late and not too early to wish everyone happy Women's Day. So we are going to celebrate our March Women's Day celebration this month. Okay, so with the semangat, with the spirit, our belief that we are stronger together. And I believe also half of her beauty is her brain. So make sure we feel our brain, not only physical beauty, but also our minds. There come the concept empower woman, empower woman. That's what I'm trying to achieve for today. So it's not for just for us, but later on to our patient and all our community. So, first of all, disclaimer opinion expressed in this presentation, which is my presentation, is following solely those two presenter. Okay, this is my opinion. So, let's talk about HIV preventions. It is a vibe. So, whether it's good vibe, bad vibe, or what is the sebenarnya, the atmosphere. So let's talk a little bit about controversy before we start our main topic. So PrEP, PrEP, or we also talk as a PrEP. PrEP, fatwa about PrEP. In Selangor, Sabah and Penang, they talk a little bit more about PrEP and saying it is dibolehkan kepada pasangan suami isteri seperti nurse yang banyak melakukan suntikan. But it is haram for the pasangan sejenis yang mengambil untuk mengelak AIDS disebabkan perbuatan songsang. So ini adalah kontroversi once we initiate program PrEP in Malaysia, especially in our government healthcare facilities. And I just going to straight to this topic, saying Jabatan Mufti Negeri Selangor dilarang memberi PrEP pada pasangan homoseksual. And later there is a statement by Jabatan Mufti Selangor saying, ask about the question, directly about the question, apakah hukum seorang pengamal perubatan memberikan ubat pencegah HIV or known as PrEP, pre-exposure prophylaxis kepada individu yang mengamalkan homoseksual. So this question been asked and been answered as well. So in Jabatan Selangor, they answer clearly saying it is diharuskan kepada suami isteri yang di mana salah seorang daripada mereka telah dijangkiti oleh HIV. Bagaimanapun, pemberian kepada mereka yang diketahui mengamalkan cara hidup homoseksual adalah dilarang dan dianggap sebagai bersubahat dalam perkara dosa dan maksiat. This is something to discuss, but not for today. This is the controversial issues that I'm giving you the vibe of HIV prevention in Malaysia. But as I said earlier, as we are in conjunction of Women's Day, we would like to talk about Women and Girls HIV AIDS Awareness Day. So my aim is actually to discuss, to clear and share the knowledge regarding PrEP for women. Is PrEP for women? So before we jump into PrEP, what is PrEP, how it's been given, etc. and etc., let's have a clear view about changes HIV landscape from 1990 till to 2021. So it is interesting facts that in 1990, The mode of transmission of HIV in mainly 61% is IVDU, intravenous drug user. So through injecting drugs. And later on in 2010, we see that the heterosexuals is 40% and IVDU is only 48%. It shows that sexual behavior is the mode of transmission for HIV in Malaysia during that time. And interesting, in 2021, heterosexuals represent 33% and male sex with men represent 63%. If we calculate it combined, it is 96% sexual behavior is the mode transmission of HIV in Malaysia. Interesting. And IVDU is only caused by 3% only. So let's see another statistic. HIV prevalence among men who have sex with men. So in nationals, we can see the numbers is increasing. Same go to Kuala Lumpur. Okay, next. We already talked about statistics. We already know a little bit about the ideal mode of transmission. We are talking about sexual behavior is the main mode of transmission of HIV in Malaysia. So how we can approach to prevent HIV? So come back to the main basics prevention. So we can look at into the diagram. Here there's a multiple program, multiple activity, multiple approach that we try to prevent HIV. So this is where I would love to highlight the pre-exposure prophylaxis medications. We are focusing on the medication for prevention. So we already talked about PrEP, but what is actually PrEP? PrEP stands for pre-exposure prophylaxis. It's a medication. It's a medicine that reduces the chance of getting HIV from sex or injecting drug use. And it's only involves taking one tablet a day or prior to a risk events by HIV negative. So have to be highlighted here is for HIV negative individual. It is used to prevent HIV. So whoever has already HIV positive is not going to work. Okay. So please to emphasize PrEP is highly effective for preventing HIV. How effective it is, we're going to talk about it. So again, PrEP is mean, pre is before, exposure is coming into contact with HIV, prophylaxis is a treatment to prevent infection from happening. So in the world, approximately 1.1 million people are at risk for HIV and they are benefit from comprehend HIV prevention strategies including PrEP. So we are trying to promote PrEP for these 1.1 million people who are at risk of HIV. So let's have a look a little bit of data here. PrEP immunization in Asia Pacific in March 2022, which is just recently, it's just last year, and Malaysia is at the yellow color. It is less than 500 cumulative immunization across all products. So a little bit low numbers, but hopefully we are getting there. So if you have a look here, for those who love to know where is my PrEP facilities that provide this service you can just search online my PrEP locator and search for Malaysia. And interesting, there is a 50 healthcare centers registered in Malaysia, but unfortunately, it's only 4 klinik kesihatan provide this facility. We try our best to increase the facilities. Hopefully, can reach more people for those who are in need. Okay. PrEP or PEP. Have you heard about PEP? PEP is post-exposure prophylaxis. That means it's already have the exposure, but PrEP is pre-exposure prophylaxis. So this is a strategy for an individual who are at risk by taking medication regularly. So this to prevent HIV. So repeated exposure we can suggest for PrEP. So if we can look at the graph here, so PrEP is for people at substantial risk of HIV and not forever. That's mean that people who are at risk, who already know they are at risk because of their behavior, because of their partner, because of their sex life, they know that by taking PrEP, they can reduce or prevent HIV, uh, from prevent HIV. So who are people recommended for PrEP? Who are qualified, who are suggested, highly recommended for PrEP. So if we can have a look here, there is a 4 category of HIV negative individual who are highly recommended for PrEP. So first category is male sex with male and are sexually active within the last 6 months. Second is heterosexuals, that's mean men or women are sexually active for within last 6 months. And third one is the transgender, man or woman are sexually active within the last 6 months. And all this category who are also having any of the following: a partner who is HIV positive, inconsistent use of condom and STI, and also individual who are having STI and requesting for PrEP. So those 3 categories are highly recommended for PrEP, including the fourth category, people who are inject drugs, or we call it PWID, PWID, with any of the following: who share drugs, equipment, and at risk of HIV accusation from sex. Okay, so the question raised, how effective is PrEP? Why? How good is PrEP? So basically, based on through all the research has done, it shows that PrEP reduce HIV transmission from sex by 99% who are having sexual behavior with men who have sex with men, 99% who are having a heterosexual partner, 75%, and injecting drugs user, 74%. Imagine 75% is a huge number and is show a very good effective medication. So why must we take drugs to prevent HIV? Why we have to take before we have HIV? It is because first to take care of your physical health, that's the top, and second is to take care of your mental health. You feel control. You know that you can do something to control the environment, to control before getting the HIV. And also, last but not least, to take care your sexual health. It is very important. So, please to emphasize, PrEP is in pregnant and breastfeeding woman. It is safe. It has been done multiple research has been done. In conclusion, pregnancy outcome and early infant growth did not differ the PrEP exposure. That means there's no significant whether they are taking. There's no difference in the outcome. That means it's not going to affect the baby, and also for those who are pregnant and those who are breastfeeding. So PrEP is safe to take while pregnant or breastfeeding. Something to share, prevent HIV with PrEP for your peace of mind and body. Okay, let's talk about the contraindication. We already talked about who are highly recommended, why it is highly recommended, how effective it is, but there's also a contraindication for those who are having a chronic kidney disease with EGFR less than 60 ml per minute, who are already positive or evidence of possible acute HIV, and third, who already known to have any allergies to PrEP component. And last but not least, unable or unwilling to follow HIV testing and return for safety monitoring visits. This is very important. Everybody was so excited, feeling empowered, feeling control, and etc. But at the end, they are not willing to do the follow up. It is very important because we have to know your status despite of taking the drugs. Are you been at how compliance you with the drugs, and also do you follow the timeline? So there's something we're going to talk about at hires a little bit later. Okay, so if a person who are able to follow for HIV testing and also monitoring visits, so this is one of the major contraindication. Okay, let's have a look. This is the tablet for PrEP drugs, either blue and it is actually two drugs in one pill and depends on the depends on the prescriptions. It's gonna be a two pills daily or once pill daily. I'm going to talk a little bit about the prescription a little bit later. So this is gonna be the tablet for the PrEP. Okay, about the dosing. So we can have it in two: daily dosing PrEP and even driven PrEP. Okay, so daily dosing, that's mean a person have to take it every day. Okay, recommended for high risk of HIV who are transgenders, female sex worker, serodiscordant woman, PWID. Okay, they are highly recommended for daily dosing. Even driven PrEP. What you mean by even driven? Even driven mean you already plan. I'm going to have a sex later with my dad on Monday, for example. So you can already predict what you're gonna do. So you can have this prescription 2 + 1 + 1. I'm going to talk about the dosing a little bit later. But even driven is only offered to men sex with men. Okay? Okay, let's see the PrEP workflow. Basically, the baseline assessment must be done by the physicians and referred by the physician to initiate PrEP. As I told before, our clinic setting there's only four who actually provide this service. So whoever having this client, potential client or client who actually request for PrEP, please kindly refer to the designated klinik kesihatan, the healthcare center. And later, the FMS will initiate the PrEP. So this uh, client will be registered, and first of all is to have a PrEP counseling. We're going to talk a little bit about PrEP counseling a little bit later, and we talk about medication dispensings and follow up later. Okay, so let's focus about the PrEP counseling. So during the PrEP counseling, it can be done by the doctor herself or himself, and later it can be done by a PrEP navigator who is a person who has been volunteered and also been assigned by MAC, Malaysia Aid Councils, to actually navigate all the client who are interested. They are been ditauliahkan, been taught, been certified by our klinik kesihatan and also MAC to give PrEP counseling. And also FMS can give this counseling as well. And on top of that, pharmacy can also give PrEP counseling. But what we want to achieve in PrEP counseling, so during this PrEP counseling, there's a few things that have to be ticked to consult the client. The indication, the efficacy, dosage, and schedule is a little bit long list, but it's going to be a very beneficial for the client, especially who are very excited but have no idea, no basic knowledge regarding this. So it's going to be a little bit long counseling, but it's going to be beneficial for them. So this is because what we try to achieve, all these PrEP counselings point we have to mention, because we will love to have the adherence, the compliance rate high. If the person, the client doesn't have the compliance, it will cause the effectiveness of the tablet. It's going to be wasteful. It's going to be useless. So what we try to achieve through PrEP counseling is to try to engage with the client to make sure the adherence rate is high. And of course, the side effect has to be mentioned earlier during the PrEP counseling, because usually not just PrEP drugs but others drug as well. Once a client or our patient already get the side effect, they try to skip the medication. Is it correct? It's common. It's very common. And then they will say, "Oh, I don't want to take drugs for today, maybe tomorrow after the side effect gone. So it's going to be very shameful because the drugs will not be effective. It's not going to protect this person. So they will come to you saying, why I still have HIV despite of taking this drug? But the way they are taking the drug is wrong, or they are skipping the pills. They are not going to have it because of the side effect. So please mention the side effect during the counseling, PrEP counseling. Okay, so PrEP is for everyone. What I'm trying to say in this picture is PrEP is for everyone. Okay, so let's talk about how to prescribe these PrEP drugs. Okay, we can have the daily dosing, event driven, and how to stop. This is what I have talked a little bit before. Daily dosing, everyone at risk of HIV, as mentioned, there's a few category and leads in 7 days. But for event driven, we only give it to male sex with males and lead in 2 hours. Okay, so to stop for female IVDU trans women on hormone is 7 days, and however for cis men, transgender, gender, and etc. is not taking other hormone for 48 hours. Okay, it's a little bit details on the clinical part, but I really hope I can share this slide later on, and then it can absorb the you guys can share and explain. Okay, I think for event driven, I don't want to go deep, but let me share event driven. This gonna be a easier way to understand. Okay, for even okay, a real life example for event driven. This for male sex with male. Okay, don't confuse with daily dosing. So evidence based dosing, if you are having sex for once a week, so before sex, two PrEP tablet at least 2 hours and ideally 24 hours. That means you are going to have a sex on Friday. Sorry, your client going to have a sex on Friday. So make sure to have the 2 tablets of PrEP 24 hours before the event, before Friday. So Thursday, you already have to take the medication on Thursday. And then after the client having sex, after sex, one PrEP 24 hours after the first dose. And then on Saturday, on the following 24 hours to have another one tablet, and the next 48 hours to have the second one tablet after sex. So in total, so the numbers gonna be 2 plus 1 plus 1. That's how it goes. Okay. So it goes okay. So same goes with, however, there's several scenario that I share over here. So if it is person who actually is not even driven, who are actually at risk, for example, serodiscordant couple who are female sex worker who are very at risk and having unexpected events or having repetitive sex, unplanned sex. So it is suggested to have it daily dosing instead. Okay. Okay. So for follow up, we have to make sure there is a several follow up has been taken. So for HIV test, usually we will see these patients before we will take a list of baseline for first month, third month, and every 3 to 6 months. Okay. And I pleased to share what if situation this if, as we know, our patient is individual. We cannot take a blanket rules for everybody, even though we already say the rules going to be 2 plus 1 plus 1 plus 1, or it's going to be a daily dosing, but there's always be a individual scenario. So please to share what if situation over here for your reference later. Okay. And please, if there is any problem, to refer back to your FMS who has actually been certified for PrEP, and they already been given a very in-depth PrEP education on this one. Okay, I know PrEP is very, very new things, but it's something we have to explore. We have to give this service to our potential client. Okay, there's something that we have to know about discontinuing PrEP. PrEP can be discontinued at any point. At any point, as I mentioned before, in the graph, once you know that you are not at risk, so you can stop immediately. No worries. But to be discussed before discontinue with your clinicians. This is because the protection from HIV will wane over 7 to 10 days after ceasing daily PrEP uses. For example, the person who are already taken daily PrEP drugs for example, 3 months, and then she said, "I'm not going to have this any sexual behavior for the next 1 year, so I would love to stop." And the protection from the PrEP is actually weaned off over 7 to 10 days. Okay, let clear our minds, think why should women take PrEP, and come back to the reason. We already know what is PrEP, why it is recommended, who is the category being highly recommended, how effective it is, and at the end, it's actually women should take PrEP because you are in control. You are worried, you can control your decision, you can have your enjoy your sex life, and because PrEP is safe and effective, it's safe during you're pregnant or during breastfeeding, and it is effective up to 99%. As I mentioned, it is effective, highly high percentage of effective if it is been taken um, and at higher follow the instruction. Okay, so when we talk about adherence, it's going to be quite difficult. It stick firmly to prescribed regime, but we have to know it's going to be right dose, right frequency, and right time. And how how is it if you forgotten, you miss, or you delayed? What gonna do? What you should do? What is the correct advice you should tell to your client? So if you've forgotten, miss, or delay first rule, take the medication as soon as you remember. But don't take double dosing. I will explain a little bit later about this. And if it's daily dosing within 12 hours, take the missed dose. If it's more than 12 hours, you forgot or delayed, don't take it. Okay, I describe it in this graph. So usually you have your daily dosing at 10 p.m. and then you miss it. Somehow you can't remember, and then you wake up at 6 a.m. the next morning. So you remember at 6 a.m. straight away have it. But you wake up at 9 a.m., it's still within 12 hours. Eat it right away, continue next 10 p.m. dose as usual. But how if you miss it more than 12 hours, you wake up at 10:30 a.m. Don't eat it. Don't eat the missed dose. Just continue. Have the next dose at 10 p.m. So I really hope this graph is very clear to understand. So this what we try to say HIV risk reduction efficacy. If it been taken daily, 7 days per week, the high effectivity is up to 99%. If it's only taken 4 doses per week, it's up to 96%. And it's only taken for 2 days per week, it's only up to 76%. So what I'm trying to say, medication adherence is really, really important to maximum the prevention benefit. So if you want to have the highest benefit of this PrEP, you have to make sure you compliance to the medication. Okay, as we mentioned, adherence cause have there are several factors that affect the adherence to PrEP: patient factors, medication factors, and also the system care. So patient factors, what we try to help this person, but at most is a willing the power of willingness. So the person, if the person doesn't want to have it, doesn't want to take it, we can't help it. But there's something we can help it by remember, advice, good PrEP counseling in the beginning of it. The medication factors we already mentioned during our PrEP counselings. But what I would love to mention over here is system of care. That's something that we have to emphasize to our client. Maybe we can't help much regarding about patient factor, but this is something that we can really care for them, the system. So poor patient healthcare provider relationship. So if we can make a better healthcare patient relationship, it will obviously will help the adherence to PrEP, give a clear information and knowledge, have a frequent visit. This can really help. And last but not least, the interruption medication supply. This is something is a shame if it is happen, because in with our services that we done with the very good healthcare system we have achieved now, there's so many ways to give the medication supply through post, through drive-through, through mylocal.com. There's so many alternative for this patient to have their continuous medication supply. So I really hope it's not going to be interrupted. Okay, that's something that we have to stress on this um, adherence to PrEP. Okay, this is something that I have talked, the strategies. This list of strategies that we can encourage our client to improve adherence. Okay. By then, I think it is all for me. So I think that the conclusion of this, my topic is PrEP for women. It is for women. It is because of highly recommended, because of the effectiveness, and also um, the benefit that women can have is not just for the physicals, but also the mental and also sexual health. So be in control, empower yourself. Okay, here's my reference, and that's it.